Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Yes, indeed. This is nutritional pharmacist Jerry Hickey for Invite Health. Today we're going to discuss blue-green algae and their health benefits. Now, blue-green algae are extremely primitive microscopic bacteria. In fact, because previously they were shown to go through photosynthesis, converting sunlight into oxygen, they were classified as plants. Now, some of these algae are very healthy, namely spirulina and chlorella. In fact, specifically spirulina and chlorella. They're also very safe. In a way, they're like very primitive probiotic bacteria, but with additional content, giving them additional benefits. They're also used as food supplements and as natural coloring agents for foods. Now, throughout history, and even still until today, in parts of the world, spirulina had been used as an important source of food, supplying significant amounts of minerals, including the important minerals calcium, magnesium, potassium, and iron, many of the B vitamins, and plenty of protein. In fact, if you dry spirulina into a cake, once it's dried out, it's about 60 to 70% protein. Now, spirulina grows naturally in oceans and salty lakes. It can also grow in freshwater in subtropical climates. It's grown in microscopic spirals, which tend to stick together, making it very easy to harvest. It has an intense blue-green color, but a relatively mild taste. Aside from supplements, the U.S. Food and Drug Administration, the FDA, allows manufacturers to use spirulina as a coloring agent in gum, in candy, in cakes, and packaged foods. Now, spirulina and its cousin chlorella are so nutritious and so easy to grow that NASA is considering growing blue-green algae on board spaceships as a food for astronauts on their long voyage to Mars. Pretty much just add water and a few natural ingredients and you're done, and it grows. So let's talk about history. Historically, the Aztecs harvested spirulina from Lake Texcoco in central Mexico. Now, the Aztecs built the city of Tenochtitlan, which was located on an island within this lake. The lake is pretty much gone at this point because during the rains it would flood early Mexico City, so the Spanish residents controlled flooding with mostly draining this lake, and today most of it is the site of current present Mexico City. So what about today? Spirulina is harvested from Lake Chad in Africa. It's a major source of nutrition for the surrounding population, who make it into dry cakes. Now, Lake Chad is an important source of fresh water to 30 million people living in 4 different countries who surround this lake, and many of these regions consume spirulina throughout their life, from early life on. In fact, some anthropologists pointed out that there's a low incidence of viral infections in these populations that munch on spirulina, likely due to the effects of consuming the product from early childhood. Now, spirulina for malnutrition. It's a very wholesome addition to the diet. So given its high nutritional profile, scientists are examining malnutrition, and they show an interest in spirulina. There's a lot of research going on about it, spirulina and chlorella. Several studies have looked at the effects of its supplementation among malnourished populations, including anemic pregnant women, children in developing countries with high poverty rates. According to a 2017 review published in the Journal of International Medical Research, it really has an impact. So a study published in Maternal and Pediatric Nutrition in the year 2016 involved 87 malnourished and anemic children in Gaza. They were all under the age of 5. So the researchers gave half the children a child's multivitamin and mineral supplement, and the other half were supplemented with spirulina for 3 months. The children who received spirulina had a greater improvement in their weight and their height, in their ferritin levels, that's an indication of healthy iron, and iron levels and hemoglobin volume than the children who received a regular vitamin and mineral supplement. Now, it's not a big study, but it's a very positive study. So there was a year-long study in 2015 published in the Nutritional journal, and it looked at the effects of spirulina in nearly 200 malnourished HIV-positive patients in Cameroon. Similar positive results. The participants, who were primarily women, were given standard care for their HIV, a balanced diet, and spirulina supplements, or standard care and a balanced diet without the supplements. So there was no placebo here. And the participants receiving the spirulina, their immune system cells that were greatly reduced due to the HIV increased in number, as did their hemoglobin levels. Supplementation may also benefit HIV patients via immunomodulatory effects by reducing the viral load, which has been shown in other studies. In 2016, the government of the Indian state of Karnataka instituted a statewide program providing malnourished children with spirulina supplements. This is according to the India Corporate Responsibility and Sustainability Network. Now, the reported results of the study: a 46% reduction in malnutrition cases among young children, pregnant women, and lactated breastfeeding mothers. And the scientific studies are underway to better understand why in this program. In other studies, foods fortified with spirulina were found to help motor development and prevent morbidity, sickness, due to upper respiratory tract infections in infants, and positively affect development in otherwise malnourished children. Now let's talk about safety. It depends on how you grow the spirulina and chlorella. Sometimes it could be contaminated with other algae that are a little bit toxic. You've heard of algal blooms. So for us, we get our spirulina and chlorella from Hawaii. It's grown in vats in purified water. So we know that there's no contamination with other algae. That's very important to us because we like to play it really safe. So let's talk about the benefits of supplementation with spirulina and chlorella, blue-green algae. So as a supplement in the USA, studies show that spirulina may be effective against allergic rhinitis, for managing some of the problems with diabetes, for relief of chronic pain, and may benefit obese and overweight adults by reducing triglyceride levels, and for helping weight loss management. Preliminary data suggest it may be safe and effective for treating chronic hepatitis C also. So let's look at some of the studies. This one would have to do with an antioxidant effect and an immune system enhancing and healing effect. So these are people in Kerala, India. They chew pan tobacco. Now, pan tobacco is prepared from the leaf of the betel nut, and chewing it causes leukoplakia in the mouth. Now, leukoplakia is a thickened white patch that forms like on your gums or the inside of your cheeks or on the bottom of your mouth, and sometimes on your tongue. Like if a dentist saw it, they would warn you to go see a doctor, because this can be precancerous. You can't scrape it off, and it can eventually transform into cancer. And leukoplakia generally is related to chewing tobacco, smoking tobacco. So the researchers tested spirulina in these tobacco chewers. 87 people in Kerala, India, who regularly chewed pan tobacco, who had the precancerous sores in their mouth. After a year on spirulina, 45% of the tobacco users saw a complete regression of the lesions, completely gone. Just 7% of the people in the placebo group saw a complete regression in the precancerous sores over the same period. Now, this is according to a study published in the journal Nutrition and Cancer. Years ago, I read a follow-up to this study. It seems a year after stopping the spirulina, the sores were starting to grow back in the mouths of some of these people. So the spirulina definitely had an effect. So let's talk about immunization. In people with weak immune systems, and you give them an immunization against the pneumonia bacteria or the shingles virus or the flu virus, and eventually with the coronavirus, if they have a weak immune system, they don't respond well and they don't create enough antibodies so they could still get sick. This also happens in elderly people in their 70s and 80s. And it also happens in obese people, by the way. That's a very important finding. People who are obese, I'm not talking about overweight. I'm not talking about people 20 or 30 pounds overweight. I'm talking about people 60, 70, 80, 90, 100 pounds overweight. People with a body mass index of 30 or 40 or beyond. Okay, they're clinically obese. In obese people, when you give them an immunization against the flu or some other infectious organism, it doesn't take well. They still get sick. So this is very important because this current coronavirus plague is really affecting overweight people. So even when they come out with the immunization, if you're very overweight, it's not going to help you. You have to lose that weight. Chlorella and spirulina can help a little bit, but there are true ways of losing weight. We've gone into that in some of our other podcasts. I'll tell you two quick side things. Drink a big glass of water, like 12 ounces, a half an hour before each meal, and walk for 10 minutes after each meal, and you'll lose weight. That's just a quick, easy way to help you start losing weight. It's so important right now with the coronavirus, because that virus is vicious when you're overweight. So here's immunity with chlorella. They gave chlorella supplements to people in their 50s. Now, this is according to a study in the Canadian Medical Association journal. That's like the Journal of the American Medical Association. And when they gave them chlorella, the flu vaccine took better in these patients. They made more antibodies to the flu. So here's what they said. This is Dr. Scott Halperin. He's pretty famous. He's an associate professor of microbiology and immunology up in Dalhousie University in Canada. He's famous. He's written a lot of papers on immunity and viruses, etc. Our clinical study clearly demonstrates chlorella has a biological effect in humans, increasing the antibody response to a flu vaccine in this population. It's very important. So in other words, if you can get chlorella, and you're going to take it before you have an immunization, it's going to improve your response to the immunization. You're going to create more antibodies, and the immunization will work better. That's important for older people. That's important for obese people. That's important for diabetics. Anybody whose immune system is not up to snuff. Now, here's elderly people. It's the University of California, Davis. It's in the journal Cellular and Molecular Immunology. Daily supplements of Hawaiian spirulina, which is what we use in our products, may boost the immune system of seniors and offer an opportunity to counter anemia also that's associated with aging. It's a new study from the University of California, Davis. 12 weeks of spirulina increased counts of white blood cells. You know, these are the foot soldiers of your immune system that fight infections like neutrophils and macrophages, with older women reporting a more rapid response. So this is good. This is all good. So let's look at some of the more the studies on the immune system. These are people that are fed chlorella for 4 weeks before and for 2 weeks after an intense training period that took place over 2 days. And when they gave, so these are athletes, they're training, they're giving them spirulina for 4 weeks, they train intensely, crazily for 2 days, and then they continue to spirulina for 2 weeks after. It maintained the level of immunoglobulin A. It's the University of Kent, which is in England. It's in the European Journal of Nutrition, so let's explain what that's all about, because they duplicated their studies. They did this a second time. The first study was in 2007. They replicated their study results in 2008. So what does that mean? When you do intense exercise, you release stress hormones, and that suppresses your immune system for about 6 hours after. It suppresses immunoglobulin A. Now, immunoglobulin A is the dominant immunoglobulin that protects you in your tear ducts of your eyes, in your nose, and in your mouth. These are ways that people catch bacterial and viral infections. So if you do intense exercise, your immunoglobulin A levels drop for hours after. It's a lot easier to get sick. I mean, you see this all the time in the Olympics, that the Olympic athletes, they all have the flu. Far more Olympic athletes will develop the flu than will couch potatoes, people who habitually sit on the couch and watch television or play video games. It's just amazing. Okay, so here's a study in BMC gastroenterology on patients with hepatitis C. Now, there's no placebo in this study. They're using the ingredient for milk thistle called silymarin, which we know is good for the liver, or spirulina. And they found that giving patients with hepatitis C spirulina over a 6-month period really lowered their viral titer. It was putting them into like complete remission, basically. It also strongly lowered liver enzyme levels, ALT. When a doctor does a blood test, one of the things they look at is your liver enzymes, and ALT is specific just to your liver. If ALT is higher than normal, that means liver cells have died. Now, the milk thistle also gave a good response, but the spirulina was more effective. Now, what about allergies? Here's European Archives of Otorhinolaryngology. And when they gave people with allergic rhinitis is like allergies to tree pollen and grass pollen and weeds like ragweed. When they gave them spirulina versus placebo, it helped with runny nose and stuffed nose, sneezing, itching. I mean, it really meant something for the symptoms of allergic rhinitis. So that's good. On one hand, like the patients with the precancerous sores in their mouth that were chewing tobacco, and here the patients with allergic rhinitis, the spirulina is correcting the immune system. Whereas in the people who were doing intense exercise or elderly people or people getting a flu vaccine, the spirulina and chlorella were actually energizing and improving the immune system. So I'm going to read you one or two more studies, and then we'll finish up. This is heart health. It's researchers from Seoul National University in Korea. It's in the Nutrition Journal. And when they gave patients chlorella, it did good things for the heart. When they gave them chlorella versus placebo over a 4-week period, chlorella strongly reduced triglycerides. Now, that's one kind of greasy fat that leads to fatty liver and fatty deposits in the heart and fatty deposits in the lungs and kidneys, but it triggers strokes and heart attacks. It's one of the things that clogs your arteries. Giving chlorella lowered triglycerides by over 10%. And it modestly lowered total cholesterol, but it strongly lowered bad cholesterol. It lowered the LDL bad cholesterol by 11%, but it also lowered apolipoprotein B. Now, that's very important. Apolipoprotein B is what makes bad cholesterol sticky and invasive and dangerous. So not only did it lower bad cholesterol levels, this is what statin drugs do, but it also made them less sticky and invasive. So that's a win-win-win right there. For lowering the risk of heart disease. So what about type 2 diabetes? This is Nutrition Research and Practice. It's a 12-week-long study in Korea in patients with type 2 diabetes, and they gave them spirulina or placebo, and over the 12 weeks they found, once again, it significantly lowered triglyceride levels. But it also improved adiponectin. Now, that's really important. Generally, in diabetics, the hormone adiponectin is very low. Adiponectin improves your insulin sensitivity and helps you treat and prevent diabetes. It also burns belly fat. It also kind of slows down your appetite if you're an overeater. And beyond that, it preps your muscle health. And muscles tend to store sugar, so this is one of the ways that the spirulina can help the health of diabetics, not only lowering triglycerides, but improving adiponectin levels. Beyond that, if they had elevated cholesterol, it lowered their total cholesterol and their bad cholesterol, the LDL cholesterol. But it also lowered interleukin-6. Now, that's really important. In diabetics and people with high cholesterol, elevated interleukin-6 inflames them, and it also clogs arteries. It's like one of the cytokines of the immune system involved with inflaming the blood vessels inside your heart and leading to heart disease. So there's a lot of good findings here. And it restored antioxidant levels in these patients. Now, what about fat fighting? Spirulina helped people with weight loss. These are very overweight people. It's the journal Complementary Therapies in Medicine. And when they gave them, it's 300 people that are overweight, 5 different studies, so it's a meta-analysis. On average, it lowered their fat by 5 pounds. So it was giving them better nutrition, helping them feel more full, giving them protein. That's always good for helping improve your weight and your blood sugar and controlling your appetite. And they lost 5 pounds as a consequence of that. So if you look at these blue-green algae, they help your immune system function better. They help with improper immune system functions such as allergies and lowering inflammation. They help you control your blood sugar. They help with liver health. They help you feel more satiated and help you lose a little bit of fat if you're overweight. And they have heart benefits, lowering your triglycerides, your total cholesterol, your LDL cholesterol, and inflammation in your heart. And that's all good. Plus, they're making the bad cholesterol less sticky. Thank you for listening. Thank you for tuning into the Invite Health podcast. Now, before we go, let me give you an email address that goes to a bunch of our nutritionists. In case you have a question about anything I said on this podcast, or you have a question in general on nutrition or a supplement you're using, or your diet or exercise, anything to do with health. Nutrition@invitehealth.com. We have 5 nutritionists connected with that email address. You send an email, you get a quick response. Nutrition@invitehealth.com. Because we have a scientific department, I'm the chairman of that department. I'm the chief scientific officer. And in that department, we have naturopathic doctors, registered dietitians, clinical nutritionists, several pharmacists, nutritionists, sometimes chiropractors, sometimes medical doctors, PhDs in nutrition. We have a lot of these people working with us. So thanks for tuning into the Invite Health podcast. Here's that email address again, nutrition@invitehealth.com. Now, as far as our episodes, you can find them for free wherever you listen to podcasts, or you could just go to our website, invitehealth.com, and just scroll down, and you'll see an icon for the podcast, and also for the radio programs. We do a lot of radio. Please subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram @Invite Health. Hope to see you next time on another episode of the Invite Health podcast. Thank you for listening, and think about that spirulina and chlorella, adding it to your diet for better nutrition.